Julie. I am a UMass nurse practitioner student. And may I ask for your name and age?
Sure. My name is Derek Raymond, and I'm 46 years old.
Okay. So they've asked me to come in and kind of do an interview about your health, past and present, and then to do a physical examination. It will be recorded for training purposes. Is that okay with you today to do both the physical and interview as well as being recorded?
Yeah, totally. Yeah.
Okay.
Yeah,
Is it okay if I sit down with you?
yes, please.
All right. So tell me how you perceive your health. Do you feel that you're in the best shape of your life, or do you feel like your health could use some help?
I actually feel like I'm in really good health. Probably, the best shape of my life.
Okay. And what do you do to maintain your health? Do you feel like you have a good, you work out, you eat right? So tell me a little bit about how you maintain your health.
Kind of like you said, so I work out regularly. I eat very healthy. I go to my doctors, dentists, all the doctor's appointments and things that I'm supposed to keep. I stay up on my appointments.
So you have a lot of great healthy habits, you would say.
Yeah, absolutely.
Okay, so those are your healthy habits. And then how about for, again, health maintenance? Do you see a doctor regularly?
I do. So I see my primary care physician. I see him once a year.
Okay. Do you see a dentist regularly?
I do. So I see my dentist twice a year.
Okay. Do you see any specialists regularly?
I do have a neurologist for a seizure disorder, and I see my neurologist once a year.
And then do you also, so we went over that. And do you also keep up with your health, like your colonoscopies, things of that nature?
Yes, I do. Yes.
So you go, it's every 5 years?
Every
correct?
5 years, yeah.
For your colonoscopy?
And it depends, like if you have findings, they may do every 3, but I'm in the 5-year category.
Okay, great. Do you feel like you have any health stressors at the moment, or stressors in general in your life?
No, not that I can really think of.
That's great.
Yeah.
It's really great. If you were to have some stress in your life, how do you feel that you cope with it? Do you feel you cope well with it, and what do you do to cope with it?
So because I work out regularly, that's kind of that's my way of getting my stress out, is by working out regularly.
That's great. Do you ever turn to substances when you're feeling stressed out? So any prescription medications that you might use not as advised, or any illicit drugs?
No, I don't drink or take drugs.
Okay, so no drinks, no drugs. Do you smoke?
I do not smoke.
Okay, have you ever smoked?
No.
Okay, and that includes tobacco, vaping, smokeless tobacco, like chewing tobacco, anything like that?
No, I do not. No.
Okay, great. So that's kind of, how we're doing right now in your health. So just to reiterate, you feel that you have a really good place in your health right now. You're eating right, you're going to the doctors, your specialists, doing all the things you're supposed to. Is that correct?
That's correct.
Okay, so let's move on to kind of your past medical history, if that's okay.
Okay. Yeah.
Do you have any allergies to foods?
I do not have any allergies to foods. No.
Okay. Do you have any allergies to environmental factors such as pollen, dust, molds, anything like that?
No allergies to those things.
Okay. And do you have any allergies to medications?
I do. So I do have. I'm allergic to penicillin. All the penicillins, actually.
Okay. And what happens when you take a penicillin?
So I break out in like rashes and hives, kind of like on my inner bicep and then on my thighs.
Okay. Any difficulty breathing?
No.
Okay. So that's all penicillins, or excuse me, all
All
cyllins, I should
cyllins,
say.
yeah.
Okay, great. Any chronic illnesses that you are dealing with, or disorders?
I do have a seizure disorder.
Okay. And do you feel like that's well controlled right now?
I do.
Great. Okay. Sorry. When was your last physical examination?
My last physical actually was just in May.
Okay. And what was the result of that?
Everything was good. Blood work was normal and no abnormal findings.
Great. That's great to hear. That's a hoorah! Congratulations.
Thank you.
So we went through medications. We went through kind of allergies, any past surgeries that you can tell me?
I did have a hernia operation back in, it was March of 1999.
Okay. And do you remember the surgeon that did that operation?
Yes, actually it was Stephen Payne.
Okay. And any complications from that? Any pain that you're experiencing in the same places? Anything that you would question that maybe something's wrong with it?
No complications.
Okay, great. Any like traumas or accidents?
I had a car accident back in 2018, and it caused my lower back. Not like it didn't break, no broken bones or anything like that, but just I did experience some back soreness.
I'm so sorry to hear that. It must have been scary. Do you still feel like your back is tight now?
No.
Okay, well that's great. But it's something that we would want to keep monitoring, even though it has been several years. Just because sometimes things pop up when we least expect them. How about any other traumas? Any broken bones? Any?
I did break my arm when I was 16 in a motorcycle accident.
Okay. And any complications or problems stemming from that?
No.
No. Okay. Well, that's great. So what I'd like to do now is kind of move from your kind of past medical history into some family history, if that's okay.
That's great.
Because what we like to do is we like to see the bigger picture. So, someone in your family down the road may have a condition that might affect you at some point, okay? Do you have any siblings?
I do. I have one older brother.
And how old is he?
He's 50.
Okay. Does he have any health issues?
No.
No.
He's very healthy.
And he's still living, obviously.
Yes.
Okay. And then how about your mother? Is she still living?
My mother's still alive.
And
she's 68.
Okay. 68 years old. Oh, that's a great number. And does she have any health issues?
She has high cholesterol, high blood pressure. She had her thyroid removed.
Okay. Do you know if what the reason for her thyroid being removed was?
I actually do not.
That's okay. It's okay. So, it's something that we could always, look into if we ever needed to. How about your mother's mother? Is she still living?
She's not.
And what age did she pass away?
She passed away when she was 51 from cancer.
From cancer. Do you know what kind of cancer?
It started as breast cancer and then it metastasized.
Oh, okay. I'm so sorry. And did she have any other health issues that you're aware of? No. Okay. How about your mother's father? Is he still living?
He's not.
Okay. I'm so sorry. What age did he pass away?
He actually passed away around the same age. He was like 51 or 52 from cancer.
Okay. Again, do you know what type of cancer?
It was lung cancer.
Lung cancer. Okay. Do you know if it was like precipitated by smoking or?
Yeah. So he was a big smoker and drinker.
Okay. So any other health concerns besides the cancer?
Maybe just alcoholism.
Okay. And how about your father? Is he still alive?
My father's still alive.
Okay. And how old is he?
He's 71.
And does he have any health issues?
He has MS.
Okay. So multiple sclerosis.
He also has high blood pressure and high cholesterol.
Okay. And then how about your father's mother? Is she still living?
No, she passed as well.
Okay. And what age did she pass?
She passed, I think she was like 78, and she passed from colon cancer.
Oh, I'm so sorry to hear that. Again, any health concerns that we should note in your chart? No? Okay, and then finally, your father's father, is he still living?
No, he's not.
No. Okay. And what age did he pass?
He passed at 51 as well. He had a heart attack.
I'm so sorry.
And he was a big smoker and drinker.
Okay.
So.
And any other health concerns?
No, I think just the heart and then alcoholism for my grandfather.
Okay, so we kind of went over your family history, and now I just want to kind of go over what we call kind of psychosocial factors. So I'm going to ask you about your support system. Do you feel like you have a good support system, whether it be your family, a girlfriend, a religious group, anything like that?
Yeah, I have a good support system. I have my girlfriend, I have the CrossFit community, the gym I go to, so I have a pretty good support system.
So if you ever felt like you ran into a problem, you would have help for that?
Absolutely.
Oh, that's great. That's so nice to hear. Let's talk about your home. Do you live in an apartment or a house?
I live in a house.
And can you tell me a little bit about your house? Is it?
It's a ranch.
Okay.
It's a 1-floor ranch.
So 1-story ranch. Okay. Do you feel like there's any problems with pests, molds, pollutants, anything like that?
No, nothing like that.
Well, that's great. Okay. And then what do you do for work?
So I work in a radiology department at a hospital, and I'm the operations manager there.
Oh, congratulations.
Thank you.
What kind of, what's your highest education that you got that you were able to attain that job?
Bachelor's degree.
Oh, congratulations.
Thank you.
That's amazing. It's, moving through school, so good for you. And then last, let's talk about a little bit about, well, not last, second to last, I should say, sexual activity. Are you intimate with your partner?
I am.
Do you feel safe at home?
I do.
Okay. Any kind of violence or no?
No violence or
Okay.
no physical abuse, no verbal abuse or anything like that.
Great. That's great to hear. And then sexual activity, like I kind of go into more. Are you safe with your partner? Are you
Yes.
safe with your habits?
So yeah, we wear protection. I wear condoms. She's on birth control.
Okay. Awesome. And you guys have a good relationship. That if something should arise, you'd be able to talk about it.
Absolutely.
Awesome. That's really nice to have a partner like that.
Yes.
And then lastly, finances. Do you ever feel like you have trouble with money to buy food, the necessities, transportation, healthcare, any obstacles or barriers that we should be aware of?
No, I feel pretty secure in that area as far as bills and things like that.
Awesome. That's great to hear. And so would you, like you said, you would go to your support system if a problem should arise, correct?
Absolutely.
Okay, well that's really nice to hear. So that's kind of more or less the interview. Now we're just going to kind of go in and ask some questions about every system in your body. So your head and your neck, your eyes, ears, nose, all those good things, okay?
Okay.
So just tell me if you have any problems with any of the things that I'm going to ask you, okay?
Okay.
So do you have any, have you had any recent weight loss, fever, chills, fatigue, or night sweats?
No.
Perfect. Any changes in your vision, any double vision, any...
No.
No?
No.
Okay. Blurred vision?
No.
Great, okay. Any, like recent headaches, skin lesions, rashes, anything on your head?
No.
Okay. How about your neck? Any any lymph nodes that you're aware of? Any tenderness, stiffness, instability in it?
No.
Okay.
I think yeah.
How about your ears? Any ringing in your ears? Any issues with your ears?
No, nothing like that. No. I think everything's fine.
Okay.
Yeah.
How about your chest? Any palpitations? Any kind of like funny feelings in your chest? Any pain? Any difficulty breathing?
No.
That's great. How about your abdomen? Any pain in your belly? Masses? Any fever? Any nausea? Vomiting? Anything like that?
No, nothing.
Okay. How about your extremities? Do you feel like your strength is in all four? Do you feel your coordination is there?
Yeah, I think I'm a little balanced there.
Great. How about any like autoimmune symptoms that you're having? Any recurrent infections that you're having?
No.
No? Okay. Let me just take a minute to think about this. Any easy bruising?
No easy bruising, no pain.
Great. So we did head and neck. We did your eyes, ears, nose. Any trouble swallowing?
No.
No. Any like you feel like you're swollen there, hoarseness, difficulty talking?
No.
Okay, so we did your throat. We talked about your chest and the respiratory for breathing. We talked about your belly, so abdomen. Any trouble urinating or moving your bowels?
No.
Any pain in your, any blood in your stool or in your urine?
No.
Great.
Yeah.
Okay. All right. So, if you are okay with it, I'd like to start the physical assessment.
Yeah, absolutely.
Okay, we're going to do a complete head to toe.
Okay.
I'm going to ask you to do some tasks. If anything is uncomfortable or you would not like to do it, just let me know.
Okay.
So it's gonna consist of me looking, which we call inspection, palpating, which I'm gonna feel around, percussing, which you're gonna feel me tap, and then again, sometimes palpating, feeling around your belly.
Okay. Absolutely.
And then listening, obviously. So I'm gonna stand up. Can you tell me how tall you are
I'm 5'7",
and how much do you weigh?
165 pounds.
Okay. If you are okay with it, I'd like to get a set of vitals.
Sure.
Okay, so you can stay nice and sitting. We're gonna start with the temperature. So 97.6 temporal. For temperature, I'm just gonna take a look at your, you can just relax down. I'm just gonna take your pulse. So respiratory rate is 18. Your pulse is 72. Now I'd like to get a blood pressure. Place on your arms. So 115/79. So all of those are within normal range. So what I'd like to do first is I would like to inspect your head. Head is normal, so phallic, symmetric, no deformities. I'm now going to take a look at the skin underneath the hair and palpate. So no masses noted, no infestations. Any pain with that?
No.
No pain on palpation. Great. Okay, so that was your scalp. I'm looking at, you are dressed for the season. Again, you are alert and oriented times 4. So you are a reliable source of information. Let's see. So I'm gonna go ahead and now inspect the face. Eyes are symmetrical, face is symmetrical, color is appropriate for patient. No deformities, no rashes, no lesions. Okay, so first I'm just gonna have you turn your chair a little.
Sure.
Thank you.
You're welcome.
Okay, so first I'm going to just press on your skin. It's called palpation. Just tell me if anything hurts, okay? So these are your frontal sinuses. Any pain with that?
No.
No pain with frontal sinuses. any pain with your maxillary sinuses?
No.
No, good. So, I'm just gonna fix your glass a little bit. So now you're just gonna feel me kind of tap on my fingers over your. Oh, excuse me, sorry. So no pain on palpation,
No.
and percussion. Both sinuses are dulled percussion. So next, I'm going to look into your ears. Ears are symmetrical on both sides of the head. Inspection of the outer ears. No lesions, no rashes. Again, no deformities. So I'm going to take a look in his ears. So first I'm just going to kind of rub behind your ear. Any pain there?
No.
How about on this side?
No.
So no pain with palpation of the mastoid process. Okay, I'm going to go ahead and take a look in your ear. So I'm going to pull up and back. So cerumen inside the ear, the tympanic membrane is pearly gray. Cone of light is 5 o'clock. And this is his, 7 o'clock, and this is his left ear. I'm next going to go on to the right side. So again, inspection of the outer ear, no rashes, no lesions. It is symmetrical. So again, I'm going to pull up and back, and no pain with that, correct?
No pain.
Okay. So ear canal is pink, no erythema, no lesions, cerumen impaction. Again, the tympanic membrane is pearly gray, and on this right side, the cone of light is at 5 o'clock. So that's that. So we have completed the inspection of your ears. Next, we're going to move to your eyes. Okay, so first I'm going to have you take a look at a position behind me, and I'm just going to go ahead and take a look at your eyes. So eyes are symmetrical. Pupils are 4 millimeters bilaterally. Again, they're, do you mind just pulling up your glasses for me?
Sure. I can take them off if you'd like.
Sure. Irises are blue, sclera is white. I'm just going to have you grab your eyelids and pull them down. Conjunctiva are pink. Go ahead and let them back up. No exudate, no drainage. Okay, so I can't really dim the lights in here all that great, but I am going to just have you take a look at my pen light. We're just going to test the ocular, extraocular movements at this point. So I'm going to have you look here only with your eyes, okay? So extraocular movements are intact in all 6 cardinal gaze. I am now going to, there's no strabismus and also no nystagmus. And now I'm going to test pupil reactivity. So go ahead. So pupils are round, equal, reactive to light, and then I just want you to take a look here. We're going to see if they accommodate. Perfect. So pupils are equal, round, reactive to light, and accommodate. Okay. Next, we're going to move down to your mouth. So I'm going to have you go ahead and open your mouth. Stick out your tongue for me. So tongue is normal size. It is midline. Go ahead and stick your tongue out a little bit more. Uvula is midline. Go ahead and close your mouth. Go ahead and open again. You can stick your tongue out for me. No lesions. Tonsils are, just kind of tilt your head back a little. Tonsils are visible, 2+. Dentition is intact. No cavities visible. Go ahead and lift your tongue up. Perfect. Again, no lesions. All right. So that is for your mouth inspection. Next, I'm going to go ahead and take a look at your throat, okay? So I'm going to palpate your thyroid, so I'm going to come behind you.
Okay.
So you're going to feel me and go ahead and swallow. Go ahead and swallow again. Good. So thyroid is normal size. No deviation, no midline shifts of the trachea. Breathing is intact. I'm now going to oscillate both carotid, palpate and oscillate carotid arteries. So first I'm just going to palpate. Good. I'm just going to take a listen to it, okay? No bruise. Go ahead. Palpate on this side. So pulses are intact. They are 2+. No bruise on either side. Again, no deviation, no midline shifts. Next, what I'm going to do is I'm going to just feel around for your lymph nodes. So I'm going to go in front of your ear, behind your ear, and down your neck and over your clavicles, okay?
All right.
So we have preauricular lymph nodes, we have your postauricular lymph nodes, cervical chain lymph nodes, and then clavicular lymph nodes. No lymphadenopathy present. So that's that. So next we're going to move to your chest, okay?
Okay.
So I know a lot of people think that breast health is just for women, but what I'd like to do right now, if this were a female, I would have, again, her, give her a sheet. I would have her take her shirt off so that we could see, but I'm gonna have just you sit right there with your arms down by your side. So I'm looking for symmetry, which his breasts are symmetric. There's no dimpling. No deviations. So next I'm going to have you put your hands on your hips. Again, breasts stay symmetric, no deviations, no dimpling, no lesions noted, and then one more time over your head. Perfect. So again, one last time, no deviations, no dimples, no, and they are symmetric. So go ahead and put your arms down. That's great. So again, you know, you think as a man, we don't have to really think about breasts. But when you're at home, to kind of look at it in the shower, it's the same way that you are doing your testicular health. So you're in the shower or you get out of the shower and you kind of feel around your testicles for lumps. You can also do the same if something is feeling off to you. So you can come down, go around, and then you also want to check inside your armpits because there are cervical lymph nodes there as well. So again, on that, you want to go around. You can even see if anything is expressed from your nipples because that again is going to be a sign that something is, it may be normal, but also it's something to look into. Okay, so we just did breast examination. Next, we are going to move to your chest. So right now, I'm going to inspect. So chest again is symmetrical. Take a nice deep breath. Chest rises and falls symmetrically. Go ahead and let it out. no barrel chest. Again, there's no deviations. So right now I'm going to palpate. So no crepitus. Perfect. Good. Okay. I'll leave your belly alone in a minute. So I'm going to listen to your heart sounds. So no rubs, no gallops, clear S1, S2 rhythm noted. Rate is regular and again, it lines up with the pulse that I palpated on his radial pulse. So that is his chest exam. Next, we're gonna move to his belly. So this one we're gonna do a little bit differently. Excuse me, let's go back to your lungs, okay? So I'm gonna listen to your lungs anteriorly and posteriorly. Again, no crepitus, no traumatus. Chest is rising and falling symmetrically. So breath is equal and bilaterally clear to auscultation anteriorly. I'm going to check here. Again, no adventitious lung sounds. Breaths are clear to auscultation bilaterally. Again, no adventitious lung sounds. So we're gonna move to the abdomen assessment at this time. What I'm going to do is I'm gonna have you lean forward just slightly. I'm going to take a look at your back. So back is symmetrical. So I'm going to check the costebral angle. All right, tell me if there's any pain with this palpation, okay? Or percussion. Any pain there?
Nope.
So no pain at the costebral angle. I can't talk right now. Okay, so belly is round, again symmetrical, no lesions, no rashes. I'm going to take a look. No visible umbilicus hernia. I'm going to take a listen to his vowel sounds. So normal active vowel sounds in all four quadrants. Okay, I'm going to just kind of palpate, okay? Mm-hmm. Any pain?
Nope.
Over here. Any pain?
Nope.
So no organs are palpable, no hepatomegaly, no splenomegaly. Now I'm going to percuss. Abdomen resonant in all quadrants. No pain upon.
No pain.
Okay, so no pain on palpation or percussion. At this moment, I'm gonna just kind of feel, because we already know that you have some hernias. I'm just gonna feel for them if that's okay. Okay, tell me.
Is it easier for me to stand up or no?
No, it's okay. You tell me if anything's uncomfortable. Okay. So you do have a hernia. Okay, so we have just concluded your abdomen assessment. So now I'm going to move to your range of motion. Okay, again, we'll start with your neck. So put your neck to your chest and to the back, to the left, to the right. Perfect. So range of motion is intact in the neck. Let's go ahead and lift your arms up. So abduction, put them down. Let's go ahead and can you move them to the back? Can you move them forward? Can you bend your elbows? Can you move your wrists? Can you go forward and backwards? Perfect. So range of motion is intact in the upper extremities. Can you move all your fingers? All digits can move. How about your thumbs? Perfect. Okay. How about pulling up your leg and extending it? How about moving your ankles? Perfect. Can you move your toes around? Can you move your knees? Can you move your legs sideways? Do you feel any clicking? I'm just gonna hold right here.
Sure.
Go ahead. No clicking, no grinding. How about your knees? Good. Again, no clicking, no grinding. Range of motion is intact in all four extremities. Let's go ahead and do some reflexes.
Okay.
So first, we're going to scooch over a little, but not too much because we're going to get the camera.
Sure.
Okay. So first, let's just do.
Come this way.
Yeah.
Okay.
We'll do biceps. So go ahead and. Okay. Ready?
Yeah.
Go ahead and flex. Okay, go ahead. And relax your arm down. Okay, ready? 1, 2, 3. Okay, good. Sorry, I don't have a real reflex hammer.
That's good.
So that's that. Next we'll do the bicep. So now bring your arm up here. Just tell me if you're uncomfortable.
That's fine.
So go ahead and flex again. Perfect. Nice and loose. Good, move your arm out. So reflexes are intact on this side. Next we're gonna do your okay, ready? 1, 2, 3. Okay. So it's intact on this side. So again, we'll start with the bicep. So go ahead and flex. Go ahead and relax. Okay. Ready? 1, 2, 3. Go ahead and relax that nice and limp. 1, 2, 3. Good. We have a little movement. Next, we are going to do triceps again. Go ahead and give me a flex. Go ahead and relax. Okay, ready? 1, 2, 3. Try one more time. slightly moved up in the hand. Okay, I want you to grab a stool so your leg can dangle. Go ahead and sit in this one. Go ahead and let your leg dangle. Okay, ready? 1, 2, 3. Go ahead and flex your. Okay, go ahead and. So I had slight movement there. And the patellar. Go ahead and flex your knee. Okay, go ahead. Come down, relax. Slight movement there. So both patellar deep tendon reflexes are intact. Go ahead and flex. Okay, going down. Okay, ready? 1, 2, 3. 1, 2. So no movement there. Okay, so no movement in that. Front. Move it down here. Okay. 1, 2, 3. Again, no movement. Okay. So you can come off of there. So deep tendon reflexes are intact. Sorry. So next I'm going to have us do some neurologic exams. So I'm going to have you turn in this chair.
Okay.
No, stand up for
Oh,
me.
I'm sorry.
No, it's okay, sorry. I didn't give you a very good instruction. So right now I'm going to have you stand this way and just walk heel to toe. Walk that way.
Walk this way?
Yep.
Okay.
So we're going to walk heel to toe.
Heel to toe?
Yep.
Okay.
So gait is steady. Patient is balanced. Come on back. Perfect. So right now I'm going to have you stop. We're going to stand just as you are with your hands down at your side, feet together. We're just going to stand here for a few moments. Okay, and then I'm going to have you, I'm going to stand right here for to keep you safe.
Okay.
And I'm going to have you close your eyes. Perfect. So neurological tests are intact. You can go ahead and open your eyes. Okay. At this point, also, to reiterate, range of motion is 5 out of 5 in all extremities. Strength is 5 out of 5 in all extremities. Range of motion is intact in all joints. I'm gonna have you go ahead and sit back down for me. So we've done carotid. Let's do temporal pulses. Which are both intact, 2+. So we've done the carotid pulses, which again were 2+. We did both radial pulses, which are intact. We will do ulnar pulses, which are 2+ and intact. We will do, sorry, go ahead.
That's great.
Brachial pulses, which are intact. Popliteal pulses, which are intact. Femoral pulses, intact. We'll have pedal pulses, also intact. Okay. Now that we've kind of done the whole thing, I'm also going to do some sensations. So I'm going to have you close your eyes, put your arms out, kind of rest on them so that they're not touching.
Okay.
Okay, I want you to close your eyes. Tell me where I'm touching you and if it's sharp or soft. Okay?
Okay. You're touching me on my left arm and it was something sharp.
Perfect.
You're touching my right leg and it's something soft.
Perfect.
You're touching my right arm, elbow area, and it's soft. You're touching my left leg. It's something, it's hard to actually tell the difference there. It's a soft.
Okay.
Touching my left knee, something sharp.
Okay.
My right thigh, something sharp.
Perfect. So that is all intact. You are able to tell the difference between soft and light touch. I'm going to have you come up. This is like the last thing we will do. It is a visual acuity. I'm going to have you stand on the X right here.
Okay.
I'm going to kind of stand and angle the camera. I don't know if you can see. There's a Snellen chart on the wall. All right, so closing your left eye, or covering your left eye
Okay.
with your glasses, and you do wear glasses. Can you read line 9?
Ooh, line 9's tough. L Z T O R. Is it T C T?
Okay, try line number 8.
Line number 8 is D E F. I'm sorry, D E T P O F E C.
Okay, try line number 7.
Line number 7 is F E L O P Z D.
So let it note that it is 2032 vision in his right eye. Go ahead and cover your right eye. Can you read line number 9?
L E T O D P O C T.
So let's be noted that he has 20/20 in his left eye. And go ahead, uncover both eyes, and let me know if you can read line 9.
L E T O D P C T.
Okay, how about line number 8?
Line number 8, D E R P O T E C.
Okay, try line number 7.
Line number 7 is F E L O P Z D.
So he is noted to have 20/32 vision in both eyes. So binocular vision is 20/32. I'll have you come sit back here. At this point, the patient would be, I would step out and allow the patient to undress from the waist down. I would then perform a genital exam, so inspection, palpation, and then also perform a visual inspection in the rectum. I would also do a digital exam, and I would check the rectum for occult blood. So Derek, it's been a pleasure meeting you today. Do you have any questions or concerns about the exam?
No.
Okay, well, thank you very much for your time, and I wish you the best.
Thank you very much. Have a great day.